So we've done hair transplantation for this gentleman, and you're going to see the follicles now. This is just 3 weeks. You can clearly see that this is the area where we've done the grafting. It's a little hyperpigmented. It's also a little bit whitish now. That settles down within a month. We're going to show you the donor area here. So we've not done his vertex. We've done the front and all the, you see, it's all beautifully healed. You can't see any spot where from we've taken the graft. Once the hair grows a little bit, then it's not going to be visible at all. And this is the area. We also now planning to start his PRP. Alright, so you ஒரு வாரம் கழிச்சு வாங்க வந்து PRP போட்டுருங்க. PRP என்னன்னு தெரியுதுல்ல, blood எடுப்போம், blood எடுத்து 20 minutesல அவங்க அந்த spin பண்ணி and then we'll take the correct thing and then we inject it. Okay, so first what we'll do is we'll give you some injections here and that will make the whole area numb. Aprom wherever we've done the transplant, only there we'll be injecting because we don't have too much volume. Sariya? Now what we are doing here, I mean our Richardsons is like we do this monthly for about 5 to 6 months. Transplanted area plus we'll be giving you what is called a cyclical therapy. Andhula vande you have medicines like folic acid supplements, B complex, blah blah, all minerals and vitamins and stuff. Daily you'll have to take. There's one for Monday and such way we call it cyclical. Then we'll give you a shampoo and then we'll give you a lotion which has a lot of minoxidil. So that lotion you'll be applying only in the area where the grafting is being done. Shampoo you will use for your whole head. You will not use any other oil or you will not use anything else. That's it. No other tablet to eat apart from the cyclical therapy tablet. And every month you will come. The kits are different for different month. Now first month will be M1, after M2 it will go like that. So we'll give you those kits. You can either come and buy monthly or you can buy for a few months and go and take it correctly and take it religiously. That's the thing. With regard to this thing, don't wear helmet or something, you know, take some care. So all of those basic care you have to do.
Job.
Sorry?
Job.
In the job?
Supervisor.
Pola. But romba veil, dust la.
Bangalore job offer.
Pola, you can go, you can do your work, but be careful. Food, no restrictions really. Take healthy diet, but there's no real restrictions for food. You can have anything.
What about this area?
That area you want to do again if you want.
Again, do that transplant.
Because we have only 3,500 follicles right? So I told you it's the front. Now, you wait for some time and all of these follicles grow up, and then if you still feel you want it, we can always do it as a second sitting 9 months later. Okay. We don't like to do it before 9 months. Alright? Alright, take care. I've given you a PRP appointment already, they just schedule you. Okay.